You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new treatment options for people suffering with TMD disorder. So if you have a sore jaw or popping and clicking, according to my first guest, or migraine headaches or neck pain or facial pain, the way your teeth come together may have something to do with it. With us, we have an expert on this topic, Dr. Wanda Mejia. Dr. Mejia, welcome to the program.
Hi, Randy. Thank you so much. Thank you for having me on your show. It's
Thank
a
you.
pleasure being here. I
Good.
know that your show reaches a lot of people that are looking for answers and looking for solutions.
Okay, good. Now, we should mention you probably gave me that nice little thank you because your husband has been on the show. Is that right?
Yes.
I knew that had something to do with it. Okay, so you brought a lot of photos.
Yes.
So for people just tuning in, you call it, I was calling it TMJ, that's the joint right here, but
That's the joint.
TMD is the disorder.
Yes, correct.
So could you give us a basic understanding of what it is and what the symptoms are?
Okay, that can present in many different symptoms. You can have jaws that will lock when you are opening your mouth really wide.
Locks?
Yeah,
Like it doesn't
locks.
close?
It doesn't close.
Okay.
It doesn't close down. That's why some of my patients, they are even afraid to bite into a big sandwich or even afraid of yawning because that will cause a trigger.
Like they have to
Yeah.
kind of move their mouth just to close their mouth?
Yes, they
Really?
actually have to massage their jaw in order to close their mouth.
Okay.
They also have a lot of headaches. And they said that, the headaches comes from all the way from my hairline, going through my ears, going through my neck, and all the way to my back. And some of those patients, they have sciatic pain because of the way how your teeth come together. Your jaw is connected to your head, and your head is connected to your neck. The neck is connected to the shoulders. Now, if you have an imbalance of your jaw, that's going to create a completely off track of how your spine is supposed to sit on top of.
So the TMJ is where? It's like right here?
Is in front of your ear.
So there's what, nerves right there? Is
There
that what's
are
going
a lot of nerve. That area is filled with a vast majority of nerve that innervate your facial muscles, the muscles that your muscles for chewing and for your facial expression.
Okay.
All of them come out from here. Now, if you compress that area, you are going to have pain. And also, if your jaw is positioned on an off-balance place, your muscles are going to twist and torque in order to close your teeth together. Now, let's face it, whenever we are talking, we are closing our teeth together. Most likely, you are doing it 8,000 times a day, more than the average person. But in average, once you swallow, once you are talking, once you are chewing, your teeth are coming together. And if you have to do that action over and over and over, and your muscles are being strained and twisted, then you're gonna have spasms. And those muscles are gonna shorten. And shortened muscles create more discomfort.
So tell me this, I mean, sorry to interrupt, but you have patients like every week that are like bad migraines.
Yes.
Some people have like ringing in their ears, neck pain,
Vertigo, that interfere
vertigo.
with your balance as well.
and they're reversed. You fix their
Yes.
bite and those symptoms go away.
Yes, I just
Really?
show you a video of.
I did, okay.
Of this.
It almost seemed hard to believe though.
Yes.
Like this
yes.
woman's describing how terrible her things were, and you made her teeth come together properly, I guess, with TMJ problems, and
Yes.
the symptoms go away.
Yes. Some of my patients, they travel 2, 3, 4 hours to see me. And I had a couple of patients who had told me I had to stop in my way here few times because I had these episodes of dizziness that I couldn't control my car. I had this patient, she couldn't drive by herself. She had to have her sister driving her into the office. A very young girl, 28 years old. Who wants to be 28 and not be able to drive by itself? You feel like an old gentleman, right?
All right.
She was completely devastated. She was sad. She was depressed. She didn't want to go to work.
So she had a lot of pain though.
She had a lot of pain, but her main issue was those vertigo that she didn't know where they were coming from. With her, we fixed her bite, and we were able to put her teeth where she was comfortable. She feels amazing. She now feels a different person. She's able to drive. She comes into the office with a huge smile. And you know, she is a different person. She has an aura around her that she didn't have the day that I met her.
Okay.
I mean, Randy, some of my patients, you probably haven't had a headache that lasts more than a day.
I told you in the green room that I don't really ever get headaches.
You're really lucky.
I mean, is this a big problem?
It is. It is.
I mean, a lot of people suffering that don't have to
A
be.
lot of people suffer that they don't have to. I have this cup. He was taking every 4 hours Advil, every 6 hours Tylenol, every 12 hours Excedril. And it was just a cocktail of pills that he was, taking every day. And, I was seeing him for adjustments, and I could see how his pain, and we were resolving his pain. We were getting resolution of his pain. And today I can tell you that we got 100% back of all that pain and
So
all
he's
that
off
suffering.
the stuff. Just because the way his teeth come together.
Just because of the way how his teeth are coming together. Just because of the way how his teeth are coming together, he has balance in his system. He has more energy. He can function right now. He was going on vacation telling me, I don't want to enjoy vacation with anybody. I go on vacation, I stay in the room. Who wants to go with somebody? I'm going on vacation with you, and you're staying as my spouse, and you stay in the room.
Yeah.
That's not life for young couples. If you go on vacation, you want to experience.
So they
it.
tell you these kind of things? Like they go on
Yes.
vacation and they don't want to...
Yes. You know what? I have patients that have told me I have gone on vacation that I had stayed in my room the whole time. I had just closed the blind and just stay there because I am miserable. I don't want to make anybody miserable.
Okay.
And let's
Fair.
face it. Let's face it. Who wants to be around somebody that is constantly whining, complaining about pain, about something hurting? And sometimes patients don't get the support that they need because other people are, that person must be crazy. You cannot have so much pain and not look for help. But yes, they do look for help. They go extensive way, internet, forum. There are a lot of Facebook groups. Forum
For
groups,
TMJ
for
pain.
TMJ patients, for
So
people,
most of it is reversible.
if you know where to go, if you
Okay.
look for somebody who focus on this and who, if that person have enough advanced studies to make sure that dentistry these days is not just filling a tooth, doing a dental filling, or filling a space of an empty tooth in your mouth. This is not what we do. We look at every single component of your face, your muscles, your jaw, your teeth.
Because you're a cosmetic dentist. I mean, people...
Yes, I am a cosmetic
We
dentist.
just have you on the show talking about TMJ problems, which
Yes.
is your specialty. We should mention too, people need to know, I'm not siding with you, I'm just asking, I'm not endorsing you. This is a real interview. But this dentist treating migraine headaches and treating these type of things is now become mainstream. We've had the program for 18 years. The ear, nose, and throat doctors, the ENTs, the neurologists, now they are coming around. I mean, it's a movement where when somebody presents with these, they send them to the dentist.
Yes,
That
yes.
has this training. Do you have doctors,
Yes.
medical doctors that send you people?
Yes, I do. I have a patient that she had been suffering from TMD since 2012. Everything started because she had a filling done. And then suddenly she started to have this small little pain in the back of her ear. Now that became a little bit sharper, a little bit more dull. Things were getting more progressive. She was going to ENT. ENT were just palpating her and telling her, you need a splint. You need a spleen, but you have to go to this special dentist that will be able to bring harmony into your whole system. With that lady, we fixed her smile, and she is completely happy today. I mean, I couldn't...
So the pain goes away?
The pain went away completely. It is very challenging when somebody comes to you and tells you how much suffering they have. I have been doing this for many, many years. And still, every single patient, for me, I feel their pain. And when some of these patients come with so much pain and suffering, sometimes you're wondering, I am able to resolve all their symptoms? And over and over and over, we see that this treatment work, that we get resolutions of their pain. We get sometimes 100% complete.
Like you said on the phone, if you take somebody from a 10 pain to a 6, that's a life-changing.
That's a life-changing.
Like better attitude, more
Yes.
ambition.
Yes.
Maybe somebody from a 5 to a 2 is not a big deal. But you take somebody and lessen their pain, I guess they're...
Yeah, pain is something that all of us relate to. Who wants to live with pain? You take a couple of Advils here and there, it goes away. But when that pain comes back consequently, every day, then it takes a lot of energy. That energy you needed to function. You needed to go out to work, to enjoy with your kids, and all that stuff. Women usually handle better pain than men.
Okay.
That's why we have multiple kids.
Yeah.
But also, when something hurts us, we come to the physician more often, and we try to address
So
it.
you're telling me that if you have a migraine, like obvious symptoms, neck pain, facial pain, vertigo, whatever, and you have symptoms of, you wake up maybe with a sore jaw, or popping and clicking, or when you open your mouth, it doesn't close easily, or if you have uneven wear on your teeth, that these are people that are the easy ones, or I'm putting words in your mouth, but these are the ones you can help. If you have symptoms like that and the headaches and stuff, then chances are this is a TMJ problem. Is that true?
Yes, that's true. Definitely we help those patients, and we have helped all those patients. We have patients who have come to us with the head so debilitated and so weak that they tell me, I feel like a bubbling head. You know, those dolls that you put on,
bobbleheads.
the bobblehead dolls, because they don't have any strength on their neck.
And you fix their teeth?
Yes, that's how,
And that goes away.
and that goes away. That has a lot to do with the way how your teeth are positioned in front of your neck.
So we're gonna get to those photos in a second, but we should mention, you've trained, I guess this discipline of dentistry is called neuromuscular dentistry. You hook people up to machines.
Yes.
Kind of, right?
Yes.
And you trained at this Las Vegas Institute. Tell me about that, your training.
I have trained from the best. And Las Vegas Institute is probably the leading institute to treat non-surgical approach to TMJ.
Okay.
Now you have to know this. TMJ or TMD treatment is not a fad. It has more than 40 years of research behind
What
it.
does TMD stand for, by the way?
Temporomandibular disorder.
Okay, and that's the temporomandibular is right here.
Yes.
Okay.
You have a joint in front of your ear. When that joint doesn't work properly, then you start having disorder and you start having symptoms.
Okay.
Yeah. Now, there are two different approaches. There is a surgical approach and there is the non-surgical approach. We have seen great results with the non-surgical approach. I see patients day after day. I told you, in my way here, I got a phone call from my office that my manager was telling me that I have one patient that he's so happy with the treatment that he said, I know that I'm happy because my spouse, she said, I have never seen you so positive in your whole life.
Because they're out of pain.
You are out of pain. You are able to be the person that I married to 20 years ago. You are not in misery anymore. These are life-changing experiences. And face it, when you have pain, you don't want to be around anybody. And nobody wants to be around you.
Good point. All right.
You look unhappy. You look upset. You look angry. Some of my patients, they said, well, look, I look like an angry old man. And once they are not out of pain, they're different. They have a more positive view toward their surroundings. They can cope with everyday stress. Life is difficult. Just imagine life and pain. Now, once those people don't have pain, then life isn't easygoing. Life becomes a walk in the park.
I had no idea I had TMJ until I went to advanced dentistry. I had snapped a perfectly healthy tooth in half from clenching my teeth too hard. When I do clench, I don't get the headaches I did before because now that my bite is corrected and my teeth are sitting where they're supposed to, the pressure's evenly distributed, so I just don't get all the pain. Had I found Dr. Mejia and advanced dentistry earlier, a lot of pain and a lot of money would have been saved. Thank you, Dr. Mejia. You have changed my life.
For the sake of time, you brought photos. What are we looking at?
Yes. These people, they are sick and tired of going to the dentist and things are breaking down. Things are still not feeling quite comfortable. Things are not even looking good. Some of these patients, they go to the dentist because things keep breaking down.
Okay.
Things are not functioning the way how they are supposed to. And they keep complaining. They want their smile. They want to feel comfortable.
Like they get a crown or a bridge and it keeps breaking.
And it keeps breaking
And that-
down. Or they have it done, but they don't feel comfortable
way
with the
they're-
way how
Okay.
they are biting down. Now she comes to me and she tells me why I am feeling that all my muscles.
Is that this woman right here?
Yes, that
Okay.
all my muscles around my face are overstressing when I have to close my teeth. And yes, it was because the way how her teeth were coming together, they were not in harmony. Okay, look at her teeth.
All right.
Look how flat they are.
They're
Look how
flat, yeah.
look how flat they are. Look how much wear they have. You have uneven wear that you cannot even explain how it happened.
So that's how you know you have a bite problem, if you have
Yes.
flat teeth.
If you have unusual awareness of your teeth or teeth that break down out of, you're not gonna take a file and file all your teeth down to even them up, right?
All right.
Teeth are one of the most strongest structure in your body. They're really strong. They're supposed to last you for your whole
So
life.
if you have this,
If you have
and
this,
she had pain?
she didn't have pain, but she was breaking everything down.
Okay.
In the back, she didn't have one single tooth that wasn't broken down. Now, she also was unhappy with the way how her teeth were looking. She was like, look, I look like an old lady. And she's gonna be the mother of the bride next year. She said, I wanted to look my best. Okay, we fix her. We first relax her muscles. We make sure that her muscles are in the most harmony position. Because if you are stressed, you're not gonna look your best and you're not gonna perform your best. Then after those muscles are in a peaceful harmony, then we are able to place the teeth or to do the dentistry that she wants to have done into a beautiful smile that she's proud of. And she can just go out and show the world that, she can look better than the bride. Because that's what every single mother of the bride wants to do. She wants to look better than her daughter.
So take me through the process. How do you identify that they've got a problem with the way their teeth are coming together in your practice?
We have way how we can connect patients to modern and sophisticated software that can tell us the stress level of those muscles. Once those muscles are stressed, they will relieve pain and they will also shorten. And then we do have way to see that. We also place patients on machine that give kind of deep tissue massage into the muscles. And then that way we can record the new way how your teeth are supposed to be. Any TMD patient have shortened teeth in the back. And then in the back and sometimes in the front. Now for your jaw to bring those teeth together, they have to twist and torque those muscles. Then we have to most of the time build up those teeth to a proper balanced alignment. Now you can do it with young and healthy teeth throughout braces. That's also another modality that you can do. Or you can do dentistry, do implants, do crown, bridges, veneers. With this woman, we addressed her dentistry, the one that needed to be done because those teeth were broken down. We added height to those teeth and height to her face.
Height.
Yeah, the height.
So you're building up the teeth so they come together properly.
Yes, we built up the height in the back and built up the height of her face. And actually, she has a younger look.
So we'll try to get as many of those photos as you have. So what else do you have?
Okay, this patient right here, her mother used to tell her that she had to visit her doctor because she looked like she was having an early stroke. No, what she was having was muscles that were getting shorter in one side of her face than the other. This woman also had jaw pain and she was having a lot of clicking and popping on that side of her face. Now, we made sure that her muscles were relaxed before, and also she had a lot of broken down dentistry that needed to be repaired and then she needed to be addressed. There was one crown on the left side of her mouth that kept breaking down and she kept going back to the doctor and going back and she couldn't have any resolution of that. Right now she has a beautiful smile, everything looks even. Some of these patients, the first thing that they said, they forget about the pain completely. But they tell me, oh, I look amazing. Did you give me a facelift? I was like, okay, we need to talk about pain, remember? I said, pain is gone. But I feel different. I mean, I came here for discomfort and I look different. And these are, when you are in pain, you forget really quickly. I told you earlier, I have 3 children. I forgot about pain the moment I delivered my first one. That's why I had 2 and I had 3. But when they have that beautiful smile, and it doesn't need to be just with crown, it can be just with a straightened teeth with braces or with muscles that are relaxed. they don't even remember the pain or what they went through. They just look at themselves in front of the mirror and they feel different. I had a patient of mine, she said, I can walk out naked on the street. That's how much my confidence came back. You have given me confidence back that I never had. I don't need any makeup. I can just go about and I feel a different human being. I feel that I can conquer the world. Now, that is in part because that patient has, or that person has a lot of energy. You have a different attitude towards
When you
life.
don't have pain.
Yes, when you don't have pain. And also when you have beautiful smile, when you don't have things that are stressing your face out. Also, you look at things differently. You know, you don't have to keep thinking back and forth of what is the next medication that I'm going to take? What is the next level of medication?
Is it
that I'm
common though? I mean, you have people that were taking a bunch of medications, now they're off medications.
Yes, it's very common because most of the time people don't know how to treat these issues. The easier way is to give muscle relaxers, ibuprofen, and other levels of stronger medications, which are not good for you. That weakens your system, that puts you on the edge for everything. You have less cope mechanism and just break you down. And that is kind of like putting a Band-Aid to the problem. We go to the root of the problem. We go to why is that happening and why the off balance of your teeth is creating all these issues.
So look, knowing you were going to come on the show today, I know somebody that gets migraines, and I told her, maybe your teeth, because she had a lot of orthodontics, right? And she said, there's no way my teeth have anything to do with my migraines. Is that common where people say that?
Yes.
Because that's a hard concept to put together.
Yes, actually, when I was having my makeup done, the lady that was doing my makeup, she was talking to me about her husband. She says, my husband is having a lot of neck pain and headaches and all these symptoms. And when I see his teeth, they are completely flattened. They don't come together.
So he's a TMJ patient,
Yeah,
a TMD patient.
Yes, as I was talking to her, she was just self-diagnosing her husband. And I told her, look, you are in a great place. You have access to all these wonderful physicians, and you have to look for somebody that can treat TMD.
And so look for a neuromuscular dentist, is that what they're called?
Yeah, neuromuscular
Physiologic dentist, that's another word for it?
physiologist dentist, because how I said, you're not going to get resolutions of those symptoms until you calm the whole system down. I mean, TMD is a disorder that has a lot of components. One of them is the structural, the way how your teeth come together. But another way is the emotional way, and is the way how the pain will affect your well-being. Now, all those little things around will throw you off the edge. And the longer that you stay on that path, it's going to be more and more difficult for you to reverse those symptoms.
Because you become a negative person when you're in pain.
Yes,
You told me that on the phone.
And also,
very interesting.
Yes.
The pain patients start becoming
more negative, more dreadful to deal with. They don't have any cope mechanism.
But you see patients that have all of these symptoms, like a slight depression, that you fix their bite and they're out of pain and they become different and they're happy. That's routine in your practice?
Yes, Randy, of course. I have this 13 years old. Who is going to think at 13 years old will suffer from pain? She wrote a letter to me.
I read that letter.
Yeah, she said that her most scary moment was when she was feeling that some of the pain that she was feeling was related to older people. She said, I am 13. I was supposed to be running around the park. I'm not supposed to be here in bed. I wanted to do more sport, more activities. With her, it was obvious. She had a lot of problems. But we had identified it. We made sure that her teeth were coming together properly. And now she wrote that beautiful letter that you just read.
She did say you changed her life.
Yes. And that it is a very strong statement. I mean, I don't want it to believe I changed people's life. But when I see those letters, it just makes me extremely happy, Randy. Do I have time for just one more picture?
One more photo, okay.
Yeah. Okay.
About a minute left.
This is Marcy. She was referred to my office by her friend. And she actually, when she came to me, she was taking things to get rid of her pain. Randy, you are not a dentist, but you can tell that her teeth, upper and bottom teeth, they are not coming together.
A little off, okay.
Yeah, they are off. Her bite was the source of her pain.
So you hooked her up to the machine.
Yes.
And it shows,
It
like a
shows-
Richter scale of an earthquake, how much
Exactly how much
strain.
her pain and her
Okay.
muscles. I hooked her up to the machine. I could see exactly where her pain was coming from. I could see how her muscles were being worked out, some more than others. Once some muscles work more than others, they're gonna get fatigued. And then the other group of muscles are gonna fatigue as well.
right.
And then your head will have no balance at all. And that's when you're gonna have muscle spasms, headaches, back pain, and you name it. Now she's in a very good position. She's very balanced. She feels that her bite.
So this is the after.
Yeah, that's her after, and she looks amazing.
She does.
Yeah, she is a very sweetheart. She's
So her symptoms went away?
her symptoms went away, and she has 2 kids that she can enjoy them. And she came to my office, and I'm telling you, I could see the progress of her being out of pain.
Final message to somebody watching this, and they've heard this, but they're still skeptical. What do you say?
If you are having headaches, popping on your joints, if you cannot open your mouth wide enough, if you are feeling that when you open you cannot close it, all those symptoms, headaches, neck pain, back pain, come in for a consultation and we tell you right there if you are a good candidate.
I want to thank you for coming to the show. Great stuff. And if they call your office, they get to see you? You do the consultations?
Yes, I do the consultation. I can tell them right away if they can be the good candidate.
Okay.
Sometimes we can put people in these machines and we are able to help them out right away. I have this patient, Teresa. She came to the office with tears in her eyes, and I put, the whole complex machine all around her. By the time that she was leaving the office, she was leaving with something temporary, but she was crying out of joy. She said, I cannot.
Out of pain,
No,
leaving your office.
No, she was crying out of joy because she couldn't believe that I have already started to help her out. Her pain was going away. She kept telling me, listen, I feel that I'm starting to get better. I mean, this is...
By just what? You put some sort of a splint in her mouth?
I put some splint in her
Live,
mouth.
right there.
Right
and
there.
she's going, I feel better.
And she felt better.
Interesting.
And the funniest thing was she was taking the splint in and out of her mouth, and she was telling me, you see how the wrinkles appear and they disappear. As soon as she was putting the splint in her mouth, then the wrinkles were disappearing. And when she was taking it off, the wrinkles were appearing.
So you make custom-made appliances, and you
I
may
make-
do some dental work
Yes.
to get their bite just
Yes,
right. And we
yes.
really are out of time.
Yeah.
I want to thank you for coming on the show.
Thank you so much,
It's a
Randy.
big topic. Thanks so much. We'll have to have you back.
Yes, I will be happy to come back.
Okay, good. You're watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.